second-year Harvard student and an EBHS alumni. Please welcome to the stage Kevin Mott.
Today you have the opportunity to hear from a variety of distinguished teachers and students on what it's like to achieve happiness, strategies to achieve it, how we define it. But the story I want to share today is a little different. It's a story of stigma and challenge, of feelings of emptiness and at times hopelessness. But it's not a story without hope. This is a challenge that hundreds of millions of people across the world face who suffer from mental illness and the stigma associated with it. These are people suffering from depression, bipolar disorder, substance abuse, among other things. But this is also the story of brave triumph that Hakeem shared just a few minutes ago. And it's my hope, it's my conviction that when we live more empathetically, in tune with the challenges that those on the margins of society face, that we ourselves will benefit. We'll live more profound, deep, and happy lives. Now, my experience with mental illness actually started when I was just 5 years old. That was when my mother was diagnosed with clinical depression. Now, growing up in a household with this circumstance was difficult. I tried my best to understand what it was like for her, but I often failed. It was difficult for me to really comprehend what it was like dealing with constant sadness and fatigue, and on my end, there was just confusion. Why couldn't she just be happy? Now, I imagine my experience isn't unique for many of us in the crowd today. Either you or loved ones have faced depression or eating disorders and continue to face them. Now, when we take a global perspective, we find that mental illnesses are a problem not just in high-income countries like the United States, but across the world, in low and middle-income countries as well. We can quantify the impact that certain disabilities have using a metric known as the years lived with disability, the YLD. And what we find is, in both categories, mental illnesses make up 4 of the top 10 leading causes of disability, with depression taking the spot of number 1 in both categories. Now, we know that mental illnesses also contribute to mortality. People suffering from schizophrenia and depression are more likely to die from underlying physical conditions or from suicide. So with this in mind, it might come as a surprise to you when we compare the health burden of mental illnesses with the budget allocated to treat these disorders. In every category, we see a systematic underspending of governments, where we expect more of the budgets to be placed on these important issues, we instead see less. In aggregate, only $2 per person annually is spent on mental health. In low-income countries, this number is just 25 cents. Just a quarter is being spent on depression, bipolar disorder, schizophrenia, etc. Now, it probably doesn't come as a surprise when I tell you that for severe mental disorders, 3 out of 4 people receive no treatment, nothing at all. And a large cause of this is what's known as the workforce shortage. In the countries that are lightly shaded, we see that nearly half of the countries in the world are in situations where there's just 1 psychiatrist for 200,000 or more people. In these same countries, political will is often absent. 2/3 of people are not covered by any sort of mental health related legislation. And in the most desperate of situations, families and communities have resorted to forced restraints for loved ones in hopes that they might not hurt themselves or others in the community. Now, in Indonesia, this practice is known as pasang. And what you see here are people physically shackled to the floors of the wooden huts that they live in. Now, Indonesia has made great strides in recent years, enacting training programs for nurses to provide better mental health care. But the truth is, this practice continues. It continues in Indonesia, in parts of China, parts of Africa, and elsewhere in the world. It's symbolic of the desperation that these families and communities face when they lack the resources to treat these illnesses. Now, it doesn't have to be this way. And in fact, the tide is changing, slowly. leaders such as Kofi Annan are stepping up. They're speaking out about the importance of investing in and understanding mental illnesses. More and more research is coming out showing that investments in mental health are sound. In the UK, for instance, early intervention in suicide and psychosis is estimated to have a return of 10 or greater. And what that means is for every dollar society puts in, society gains 10 or more. That's phenomenal. There are few investments that match that scale of benefit. We also know that in the same countries that we've been talking about, lower and middle income countries, we can in fact provide quality mental health care. And people are doing this using a shift in the traditional approach to care delivery. They're opting for a more collaborative system where specialists take on a more senior role of training and supervision, and people selected from the community themselves are the ones who are directly providing care and psychotherapy. Now, this idea of task shifting and employing community health workers actually isn't new when it comes to global health. It's been done for HIV and TB, and it's worked. So we know now that there's emerging evidence that we can, in fact, treat these illnesses in those contexts. And just to give you some examples, in Afghanistan, it's a country that we don't often have the most positive associations with. Afghanistan has come out as a leader in the region in mental health. Their Ministry of Health has adopted a national plan for mental health, integrated mental health as part of their basic health package, and over the past few years, they've trained over 1,000 new healthcare workers capable of delivering basic mental health services. In Somalia, the Ministry of Health has partnered with the World Health Organization to stop this practice of forced restraints. And what you see is, over the course of 3 years, nearly 2,000 people have been unchained and are being transitioned into higher quality mental health care services. And perhaps the most exciting, you see the movement for global health there in the bottom right corner. Across the world, people with these disabilities and illnesses are rising up, they're rallying together, and they're advocating for themselves. On the screen now is a declaration written by the Pan-African Network of People with Psychosocial Disabilities. It was presented in 2011 at the World Congress for the World Federation for Mental Health. And you see, I think, a really stark understanding of the stigma that these people face in paragraph 1. But they follow up with an unwavering refusal to accept this stigma and the position that they've been thrust in. Now, for me, this is inspiration. It's a call to action. I think in many ways, the voice of students has been missing, and I think for students like yourselves, it's time to step up, join the discourse. We know students can make a key contribution in the field of global health. It's actually been done before, quite recently. I'll give you just one example. PEPFAR is a program created by President Bush in 2003 with bipartisan support. It stands for the President's Emergency Plan for AIDS Relief. And over the past couple of years, it's provided life-saving HIV treatment for nearly 8 million people and counseling and testing for almost another 14 million women. It's the cornerstone of the United States, initiative on global health. And so when this past fiscal year, President Obama proposed that we cut $300 million from this program, students like you said this was unacceptable. So we mobilized, we made calls, we held rallies, we wrote op-eds and connected with key members of the Senate who served on powerful committees. We fought and we won. We were able to reinstate the funding cuts that Obama had originally proposed. And it was through the work of students like yourselves, partnering with activists across the country, working hand in hand. So we've seen it happen. We can do it again as well for mental health. My challenge for you today, then, is to think big. What if we rallied, pushed our government to take on a greater role, a role of a leader in global mental health care and delivery? And what if our generation was the one to ensure that people across the world, regardless of mental illness or disability, that everyone would have an equal opportunity to pursue lives of fulfillment and happiness? Thank you.
Thank you very much, Kevin Mott.
You know, Ibrahim, I've